Hello everybody, today we'll be talking about corticosteroids part 2 of 3, specifically glucocorticoids. So as you know, corticosteroids is a steroid which is subdivided into two types of groups. There's mineralocorticoids and glucocorticoids. We've already discussed the mineralocorticoids in the first video. So the glucocorticoid is produced by the adrenal gland in response to stress, and they play a critical role in regulating metabolism, immune function, and inflammation in the body. So the main examples of synthetic corticosteroids with high glucocorticoid activity include prednisolone, betamethasone, and dexamethasone. So with the mechanism of action, glucocorticoids act on cells in the body to reduce inflammation, suppress the immune system, and increase glucose production. They do this by interacting with DNA in the cell nucleus, which leads to changes in gene expression. While this can be helpful in treating certain conditions, long-term use can cause negative effects on health. So this is a summary of indications for glucocorticoids. For the skin, topical steroids are used to reduce inflammation and itching, and if used excessively or long-term can cause thinning of the skin and should be avoided on active infections and open wounds. Prednisolone is the #1 drug used to treat acute COPD and asthma, and they vary in strength used. Inhaled corticosteroids are used in chronic asthma, and the lowest effective dose should be used. Steroids are also used in reducing inflammation in the eyes. One of the main dangers of their use is a red eye, causing corneal ulceration. It is also used to treat a variety of nasal conditions. Due to inadequate production of steroids in the adrenal glands, steroids are used to treat adrenal insufficiency, and doubling the dose is required in times of stress to reduce adrenal crisis. Steroids are also used in acute exacerbations of Crohn's disease. So in respiratory conditions, in acute exacerbations of asthma, in practice we generally don't need to taper. However, if the patient has a history of repeated courses, then tapering is required. And for example, prednisolone 40 mg for 5 days, and then gradually reducing by 5 mg every 3 days until reaching 0. So patients who are on prolonged courses of steroids can become dependent on them and consequently have withdrawal symptoms if stopped all of a sudden. Therefore, slow weaning down regime is required to reach the lowest effective maintenance dose. So a helpful mnemonic to remember for the key side effects of glucocorticoids is steroids. So for S, that stands for stomach ulcers. T for thinning of the skin. E for edema, which we have spelt in the US version just to help you remember. R stands for right-sided heart failure. O is for osteoporosis, which increases the risk of fractures, as well as necrosis of hip femur. I is for infections, as platelets and white blood cells increase. D stands for diabetes, as it increases glucose production. And S stands for a syndrome such as Cushing's. Cushing's is a type of disease that increases levels of endogenous steroids and can cause a variety of side effects, such as thinning of the hair, moon face, weight gain, thin limbs. So in terms of interactions, CYP3A4 enzyme inhibitors are known to increase endogenous cortisol concentrations. Therefore, when used in combination with glucocorticoids, there's an increased risk of adrenal suppression. So the below table includes a few examples of these types of inhibitors, such as antifungals such as ketoconazole, antibiotics such as the macrolides clarithromycin, and protease inhibitors such as ritonavir. Here is a main exam question you may come across, and the question is, which of the following is the correct statement? A. Betamethasone nasal drops have negligible systemic absorption and can be used for long term. B. Humavate is a potent corticosteroid. C. In an acute exacerbation of COPD, prednisolone 40 mg daily should be given for at least 7 days. D. QVAR have extra fine particles that are twice as potent as clenil-modulate inhalers. And E. A patient with adrenal insufficiency and taking hydrocortisone should half the daily dose if they have a temperature of 39 degrees. So have a think about which is the correct statement. So the answer is D. QVAR have extra fine particles and are twice as potent as the clenil. So A is not correct, as these types of nasal drops have greater systemic absorption and should only be used short term. B is not correct, as Humavate is a type of moderate corticosteroid. C is not correct, as the correct strength of prednisolone is 30 milligrams. And E is not correct, as it should be double the dose if they have a temperature of 39 degrees. Thank you so much for watching this video. Please like and comment down below on your thoughts and how we should improve our next videos and any suggestions that you may have. And please share our video. Thank you.